Brain cancer took Tom Parker, the lead singer of The Wanted, at just 33 years old. A father of two young daughters at the peak of his career, surrounded by fans who loved him around the world. Then, there was Neil Peart, the legendary drummer of Rush, one of the greatest musicians of his generation, gone at 67 after a 3-year secret battle with glioblastoma. Senator Ted Kennedy, 77 years old, one of the most powerful men in American politics. Senator John McCain, war hero presidential candidate, also taken by the same disease. Young, talented, wealthy, with access to the best medical care in the world. And every single one of them burned out right before our eyes. Why does this keep happening? Is brain cancer really the most terrifying diagnosis out there? The one that no amount of money, fame, or world-class medicine can stop? Why does it take people in the prime of their lives? Is it the constant stress, the non-stop travel, the punishing schedules? And what about the rest of us? People who never put down their phones, who live under 5G towers on every corner, and thousands of satellites overhead. In this video, I'll tell you the 7 early warning signs of brain cancer. Signs that are literally screaming, "Get to a doctor now. Stay until the end," because I'll also answer the most common question I get asked. Should you get a brain MRI just to be safe, even if you feel completely fine? And I want to be upfront with you. I'm recording this video the day after Tom Parker's story came back into public conversation, because a patient in my office asked me about it with tears in her eyes. So, let's talk about it honestly. Tom Parker was diagnosed with an inoperable glioblastoma in 2020. He fought hard. He did treatment. He performed on stage. He spent time with his family. He never stopped. And then the cancer came back. He was gone within months of the recurrence. He himself said publicly that he had symptoms for a while before he finally went to the doctor. Like so many people, he thought it would pass on its own. Now, reading story after story about celebrities with this diagnosis, you start to get the impression that brain cancer specifically targets creative, driven young people. But that's not actually what's happening. When a famous person gets sick, it's all over the news for months. Every talk show covers it. Every magazine runs the story. But thousands of ordinary Americans are diagnosed with the exact same disease every single year, and nobody outside their family ever hears about it. The celebrity stories create an illusion that brain cancer is everywhere, that all of us are at risk, that it's becoming an epidemic. Let's look at the real numbers. Brain cancer is actually rare. In the United States, roughly 25,000 new cases of primary brain cancer are diagnosed each year. Compare that to lung cancer. Over 230,000 cases annually. Breast cancer, more than 300,000. Feel that difference? That's 12 times more. But here's the critical but. Unlike many other cancers, brain cancer is extraordinarily aggressive, with a prognosis that is often devastating. And you're about to understand exactly why. Your brain is the control center for everything. Every single millimeter of brain tissue controls something vital. Removing a tumor from the brain is like defusing a bomb with 1,000 wires, and you cannot cut the wrong one. One wrong incision, and a person can lose their speech, their memory, or their ability to walk. Here's what glioblastoma looks like. This is the most aggressive brain tumor that exists. It's what took Ted Kennedy and John McCain. Look at how it grows, like the roots of a tree, burrowing deep into healthy brain tissue with no clear borders. You cannot cut it all out. Even if a surgeon removes 99% of the tumor, one microscopic cell left behind will grow it back. Now compare that to a meningioma, a benign tumor. See the difference? It grows slowly, with defined edges, like a ball. Catch it in time, remove it, and the prognosis is excellent. Full recovery is possible. But even a benign tumor can kill if it starts pressing on the brainstem or the breathing center. Now let's go through the biggest myths about what causes brain cancer. And let's start with the most popular one. Cell phones cause brain tumors. And yes, just like you, I use them every single day. Calls, messages, news, all of it. And you know what? You can keep doing exactly the same thing. Because in 2024, a landmark study was published on this very question. Scientists tracked 800,000 people over 20 years. 800,000 people, 2 decades of data, and found zero connection between cell phone use and brain tumors. Zero. But phones can still harm your brain, just not in the way you think. First, blue light. That cold glow from your screen emits wavelengths between 300 and 500 nanometers. When you look at a screen at night, that light suppresses melatonin, your sleep hormone. Studies show that 2 hours of screen time before bed reduces melatonin levels by 23%. Your brain thinks it's still afternoon when it's midnight. The result: insomnia, chronic fatigue, and a weakened immune system. And chronic sleep deprivation is a proven risk factor for Alzheimer's, depression, obesity, and certain cancers. But not brain cancer. Second, digital addiction. Every like, every notification is a microdose of dopamine. Your brain gets hooked just like a drug. The average American checks their phone 96 times a day, roughly every 10 minutes, and concentration suffers for it. There's even a term now, digital dementia. Young people complaining about memory problems like they're in their 70s. Third, tech neck. When you look down at your phone, your head drops to roughly a 60-degree angle. That puts about 60 pounds of pressure on your cervical spine, like carrying a child on your neck all day. The result? Headaches, dizziness, pinched nerves. I see patients come in convinced they have a brain tumor. Turns out it's just their posture. So yes, phones don't cause brain cancer, but they do rewire your brain in other ways. Disrupted sleep, addictive patterns, memory problems, and chronic pain. My advice: no screens for 2 hours before bed. The second big myth: headaches mean brain tumor. Here's the truth. 70% of people with brain tumors in the early stages have no headaches at all. 70%. Why? Because the tumor grows slowly and the brain adapts. Headaches only appear when the tumor becomes large enough to raise intracranial pressure. What should actually concern you are different symptoms entirely. Changes in speech, coordination problems, or phantom smells that aren't really there. And that brings us to the most important part of this video. 7 symptoms that mean you need an MRI of your brain right now, because they can signal brain cancer. Number 1. Morning headaches with nausea, especially worse when you bend forward. Number 2. A first ever seizure after age 25. Remember that number. A seizure occurring for the first time in adulthood is an immediate indication for an MRI. No exceptions. Number 3. A sudden personality change. Becoming irritable, apathetic, or strangely euphoric out of nowhere could point to a frontal lobe tumor. Number 4. Phantom smells. I had a patient who kept smelling burning rubber everywhere he went. No one else smelled anything. It was a tumor. Number 5. Sudden vision loss, or a sharp drop in hearing. Number 6. Speech and memory problems. Forgetting words, confusing the names of people close to you, walking into a room and having no idea why you're there. If this is happening repeatedly, see a doctor. Number 7. Weakness on one side of your body. Dropping things, dragging one foot. This can indicate a tumor in the motor cortex. If you've made it this far, I hope that means you find value in what I share here. If you do, please subscribe and leave a like. It helps this channel grow and lets our team keep making videos like this every week. Not every one of these symptoms means cancer, but each one is reason enough to see a doctor. Now let me explain why brain cancer symptoms are so unusual, why it's not just a headache. Your brain controls your entire body, and a tumor disrupts whichever region it's growing in. Tumor in the visual cortex, you lose vision. In the speech area, words disappear. In the frontal lobe, your personality shifts. That's why brain cancer can begin with forgetfulness, dizziness, or a change in mood rather than pain. The brain itself cannot feel pain. It has no pain receptors. It signals a problem through loss of function. Now, why do young people get brain cancer? There are actually two peaks of incidence. The first is children under 10. We're talking about congenital tumors. The second is adults over 50. The frequency curve for brain cancer looks similar to other cancers. We see a significant rise starting around age 55. What tests actually detect brain cancer? Here's what you need to know. You cannot see brain cancer on an ultrasound. The skull blocks sound waves entirely. A standard CT scan can miss small tumors. A full-body PET scan won't show brain tumors clearly because glucose, the tracer used, is consumed by all brain tissue equally. And blood tumor markers are completely useless here. There are no blood markers that indicate a brain tumor. The gold standard is an MRI of the brain with contrast. A substance called gadolinium is injected. It accumulates in tumor tissue and makes it light up on the scan. This is the only way to detect a mass as small as 3 to 5 millimeters. Should you get a preventive brain MRI if you have no symptoms and no family history? Absolutely not. This is not a cancer you catch through routine screening the way you would breast cancer or colon cancer. Some brain tumors grow so fast that the window between nothing and a 3-centimeter mass can be just a few months. Glioblastoma can double in size every 2 weeks. But if even one of the 7 symptoms I described is present, don't wait. Get the MRI with contrast. Can brain cancer be cured? Brain cancer is not one disease. It's a family of very different tumors. Stage 1 meningiomas are curable in 95% of cases. Low-grade astrocytomas have a 10-year survival rate of 50 to 80%. Glioblastoma is a different story entirely. Median survival is 15 months. Only 5% of patients live beyond 5 years. 5%. Treatment begins with surgery, removing everything that can be removed without causing critical neurological damage. Radiation and chemotherapy follow. But even after successful treatment, dormant cancer cells can remain in the brain. They sleep for months, sometimes years, and then they wake up. Finally, can brain cancer be prevented? I'll be completely straight with you. No, we don't know the exact causes of most brain tumors. The only proven link is ionizing radiation. People exposed to high levels of radiation have roughly 3 times the risk. Everything else is genetic lottery. If brain cancer runs in your family, your risk doubles. But even then, the absolute probability remains very low, because these tumors are rare. I won't sugarcoat it. Brain cancer is terrifying, but it is not the deadliest cancer. Pancreatic cancer kills faster. Lung cancer claims far more lives every year. Breast cancer takes 5 times as many lives annually. And for all of those cancers, there are things you can actually do. Quit smoking, get your mammograms and colonoscopies on schedule, treat chronic inflammation before it becomes something worse. You have real power over your cancer risk. Use it. Here's what I want you to walk away with. If even one of those 7 symptoms is present, don't wait. Get an MRI with contrast. It is always better to hear, "Everything looks fine," than to lose precious time. And remember, even with a brain cancer diagnosis, people live. They raise children. They create. They perform on stage like Tom Parker did. Not every brain tumor is malignant. And not every malignant tumor is a death sentence.